If you have been taking blood pressure medication every single day, or if someone you love has been, I want to ask you something, and I want you to sit with it for a second before you answer. How confident are you that you would actually recognize it if that blood pressure was quietly damaging your brain right now? Not in a dramatic way, not a stroke, not a collapse. I mean the slow, creeping, invisible kind of damage, the kind that doesn't announce itself, the kind that your doctor may have never once described to you in plain language. If you pause before answering, that pause tells me everything I need to know. Because most seniors I talk to, some of the most careful, engaged, diligent patients I have ever met, cannot answer that question with any real confidence. And that is not their fault. That is a failure of the system that is supposed to serve them. Blood pressure is one of the most monitored numbers in senior medicine. It is checked at nearly every appointment. There are entire medication categories dedicated to it. And yet, the conversation that almost never happens is the one about what uncontrolled pressure is doing to the brain in the years before anything catastrophic occurs. Seven signs, seven changes that most seniors either miss entirely or misattribute to something else. And number four is the one that quietly breaks my heart because it is the one most likely to be dismissed as just getting older. I'm Dr. Kalb, and this channel exists for one reason to give you the conversation your 15-minute appointment never had time for. Today, I'm going to change that. Before we go further, take a second and tell me your name and where you're tuning in from. Drop it in the comments, I read them. You would be surprised how far this community reaches. I want to tell you about Walter. Walter was 71 years old when he first came to see me, and he was not the kind of man who made a fuss. Retired civil engineer, built bridges for 38 years, precise, methodical, the kind of man who keeps a notebook in his shirt pocket and still uses a paper calendar because, as he put it, he trusts paper. Walter had been on blood pressure medication for 6 years. He took it every morning at 7 o'clock with a glass of water and a banana, without fail. His readings were decent, not perfect, but decent. His previous doctor had called him a good patient, and Walter had taken that as his assignment and carried it faithfully. But about 2 years before he came to see me, Walter had started noticing something. He wasn't finding the right word as fast as he used to. Not dramatically, not in a way anyone else would notice. Just a half-second delay that he could feel from the inside. He would reach for a word he had used 1,000 times, and there would be this brief interruption, like a hiccup in a machine that had always run smoothly. He told himself it was fatigue. Then he told himself it was age. Then he stopped telling himself anything and just waited for it to pass. By the time I met Walter, that half-second delay had become something more. He was forgetting appointments he had written down. He was reading the same paragraph of a book twice without registering it the second time. He had quietly stopped doing the crossword he had done every morning for 15 years because he found it frustrating in a way he could not explain. His wife thought he was depressed. He thought he was losing his mind. His last doctor had ordered a routine cognitive screen, told him he was in the normal range for his age, and left it there. Here is what nobody had connected. Walter's blood pressure, which looked controlled on paper, was doing something that a single reading in a quiet office will almost never reveal. In the hours between his morning dose and bedtime, it was spiking, and those spikes, recurring, quiet, unwitnessed, had been doing something to the small blood vessels inside his brain. Tiny vessels. Vessels that don't make headlines when they're damaged. Vessels that don't cause a stroke. They just slowly, over months and years, reduce the brain's ability to do the things Walter had always done effortlessly. We changed his medication protocol, we addressed the timing, and within 6 months, Walter told me the word retrieval had improved. He wasn't back to building bridges in his mind, but the machine was running smoother again. The crossword came back. The lesson here is not that Walter failed. The lesson is that the sign was there for 2 years. And nobody, not Walter, not his family, not his prior physician, connected it to blood pressure. And that connection is exactly what I want to build for you today. Because what happened to Walter is not rare, it is one of seven signs. And most seniors are living inside one or more of them right now without a single person making the connection. Here's what's actually happening. Explain simply. Your brain is one of the most blood hungry organs in your body. It runs constantly, even during sleep, and it requires a steady, precisely pressured delivery of oxygen and nutrients to do so. The vessels that supply your brain range from large visible arteries all the way down to microscopic capillaries that you would need a high powered microscope to see. And when blood pressure stays elevated over months and years, those vessels change. They stiffen, their walls thicken. The smallest ones become more fragile, and in some cases, they begin to narrow. This process has a name, cerebrovascular disease, and it exists on a spectrum. At the far end of that spectrum is stroke, which everyone knows about. But between perfectly healthy vessels and a stroke, there is a long middle territory that almost nobody talks about. A territory where the damage is real, where the changes are measurable on an MRI, but where the symptoms are subtle enough that they blend into the background noise of everyday life. There are three things happening in that middle territory that I want you to understand. The first is what we call white matter changes. The white matter of your brain is essentially the wiring, the connections between different regions that allow information to travel efficiently. When small vessels are chronically under high pressure, the tissue around them can become slightly damaged. On a brain MRI, these changes show up as white spots. Neurologists call them white matter hyperintensities, and they are associated with slower processing speed, difficulty with memory retrieval, and changes in executive function, which is the brain's ability to plan, sequence, and follow complex thoughts. This is what Walter was living with. It is not Alzheimer's, it is not a tumor, it is vessel damage. And for many people, if caught early enough, stopping the progression is possible. The second thing happening is reduced blood flow regulation. A healthy brain has a remarkable ability to self regulate its blood supply, to dial blood flow up or down depending on what you're doing. When vessels have been under chronic high pressure, that regulation becomes less precise. The brain becomes more vulnerable to brief drops in pressure, which is why seniors with long standing hypertension sometimes feel foggy or unsteady when they stand up quickly. The brain that used to compensate effortlessly now lags behind. The third is the accumulation of what I'd call micro events, brief, tiny interruptions in blood flow that may last seconds and leave no permanent deficit but contribute to the cumulative burden on vulnerable tissue. Most people never know they happen. They might notice a moment of confusion that clears, a second of visual blurring, a brief heaviness in one hand, and then it's gone. And because it's gone, they don't mention it. This is where I need you to pay attention because some of those moments are not nothing. Some of them are TIAs, transient ischemic attacks, which are the brain's most urgent warning signal, and they require same day medical evaluation. Not next week, not after the weekend, same day. What people do wrong in every one of these categories is the same thing. They wait. They wait to see if it happens again. They wait until it seems serious enough. They apply the logic that was taught to them by a medical system that rewards stoicism. The logic that says you don't bother a doctor until something is really wrong. But in the brain, the damage that accumulates while you wait is damage that may not be fully reversible. That is the part I need you to hear. I want to tell you about a second patient. Her name was Evelyn. Evelyn was 68, a retired school principal, sharp as a tack, as her daughter described her. And she had come to me not because of any cognitive complaint, but because of headaches. Specifically, a low grade pressure sensation across the back of her head. Not a migraine, nothing severe, just a persistent dull heaviness that she had been managing with over the counter pain relievers for the better part of 14 months. 14 months, 3 or 4 times a week. She had told herself it was tension. She had adjusted her pillow. She had tried a new desk chair. She had done everything a sensible, resourceful woman does before she decides something is worth a doctor visit. Her blood pressure at that appointment was 174 over 96. Not a crisis number, but not controlled. And when I looked at her medication timing, her dose frequency, and her sodium intake, which was higher than she realized because of certain foods she considered healthy, the picture became very clear. Those headaches were her brain's most consistent way of telling her that the pressure inside her vessels was too high for too long. We adjusted her treatment. We had a real conversation about her diet. Within 3 weeks, the headaches were essentially gone. 14 months of a dull daily misery dissolved in 3 weeks. And I want you to sit with that number for a moment. 14 months. Because it is the kind of unnecessary suffering that happens when the connection is never made. Now, here is where I want to draw a very clear line for you. A tension headache at the back of your head that comes and goes and responds to rest, or a mild analgesic that is worth mentioning. It may well be blood pressure related, but a sudden severe headache, one that arrives in seconds, one that you would describe as the worst headache of your life, that is a different category entirely. That is a medical emergency. You do not wait. You do not take a painkiller and lie down. You call for emergency help immediately. The difference matters profoundly, and I never want you to confuse these two presentations. Here is where it gets counterintuitive, and this is the part I want you to really pay attention to, because this is the mistake that even well informed, health conscious seniors make. You've probably been told correctly that salt raises blood pressure. So many of you have made a sensible, logical substitution. You've switched from regular table salt to a salt substitute, the ones that say heart healthy or reduce sodium on the label. And from a sodium standpoint, that is a reasonable move. But here's what those labels rarely make obvious. Most salt substitutes replace sodium with potassium chloride, and potassium in the right amounts is genuinely beneficial for cardiovascular health. But potassium in excess, or potassium consumed alongside certain blood pressure medications, creates a different kind of risk that can quietly build without any obvious warning. Several classes of blood pressure medication, including ACE inhibitors and ARBs, drugs with names ending in pril or sartan, are designed to preserve potassium in the body. They are already shifting your potassium balance as part of how they work. When you add high amounts of potassium from a salt substitute on top of that, the combination can push potassium levels higher than is safe. And high potassium, hyperkalemia, affects the electrical system of the heart. The quiet warning signs are muscle weakness that feels like fatigue, a sense of heaviness in the limbs, and heart rhythm irregularities that may feel like a flutter or a skipped beat. These are easy to dismiss. They are easy to attribute to a bad night of sleep or a stressful day. But in the context of a blood pressure medication that preserves potassium, they deserve a real conversation. This is not me telling you to abandon salt substitutes. This is me telling you that the combination of your specific medication and your specific dietary choices creates a picture that your doctor needs to see. Before you change anything, have that conversation. Ask about your potassium level, get it checked. This is the kind of silent interaction that falls through the cracks of rushed appointments, and it is exactly the kind of thing this channel exists to surface for you. There is one scenario that I don't think gets nearly enough airtime, and it directly affects seniors more than any other group. It's illness. Specifically, any illness that causes vomiting, diarrhea, fever, or significantly reduced fluid intake for more than a day or two. Because here's what changes when that happens: your blood volume drops. Your kidneys, which are already involved in how most blood pressure medications work, become more stressed. And the dose of blood pressure medication that was perfectly calibrated for your normal, healthy, well hydrated body may now be too much for the body you have during that illness. The result can be blood pressure that drops too low, causing dizziness, fainting, and falls, or kidneys that struggle under the combined burden of dehydration and medication. Or in some cases, the interaction between dehydration and your medication creates electrolyte imbalances that affect the heart. Most seniors have never been given what I call a sick day plan, a set of clear, specific instructions about what to do with their medications when illness strikes, what to continue, what to pause, what symptoms should send them straight to the emergency room. If you have not had this conversation with your prescribing physician, I want to give you the exact words to use at your next appointment. Say this: can you give me written guidance on what to do with my blood pressure medications if I become ill and can't eat or drink normally for more than 24 hours? That is the question. Write it down. Ask it at your next visit. Because the absence of that plan is not an oversight you should leave in place. Has your doctor ever given you a sick day plan for your blood pressure medications? Drop a yes or no in the comments right now, because the answers I see on this channel are genuinely informative and a little heartbreaking. Now, I want to talk about something that sounds minor but is, in the context of brain health, anything but dizziness when you stand up. It has a name: orthostatic hypotension, and it happens when you rise from a seated or lying position and your blood pressure momentarily drops because your body doesn't redistribute blood fast enough. In a younger person with healthy, flexible vessels, this compensation happens in a fraction of a second. In a senior with long standing hypertension, especially one on blood pressure medication, the compensation is slower. The result is a few seconds of lightheadedness, visual graying, or unsteadiness as you find your feet. Here's why I want you to take this seriously. A few seconds of unsteadiness is enough to cause a fall, and a fall in a person over 65 is enough to cause a hip fracture. And a hip fracture, statistically, begins a chain of events that genuinely changes life expectancy. This is not me being dramatic. This is the downstream consequence of something that seems like a momentary inconvenience. The practical adjustment is simple and effective. Before you stand, pause. Sit on the edge of whatever surface you're rising from for 5 to 10 seconds. Let your body begin the pressure redistribution before your legs are fully weight bearing. This is not a permanent inconvenience, it becomes habit quickly. But beyond the adjustment, dizziness when standing that happens frequently, that doesn't improve with the pause, or that comes with chest tightness or a feeling of your heart racing, that conversation needs to happen with your doctor. It may mean your medication dose needs reassessment. I want to address something that I see cause real harm, and it's a behavior that comes entirely from a place of caring and conscientiousness. Some of you, and you know who you are, check your blood pressure at home multiple times a day. And when you see a high reading, you feel compelled to do something. Take an extra dose, take a different medication, do something. The reading feels like an emergency that demands an immediate response. Here is what I need you to understand about how blood pressure works. Blood pressure is not a fixed number. It fluctuates constantly throughout the day in response to activity, stress, caffeine, conversation, temperature, posture, and dozens of other variables. A single high reading at 2 in the afternoon is not an emergency. What matters is the pattern, the trend over time, measured consistently at the same time of day in the same conditions. Reacting to individual readings by adjusting your medication doses on your own is genuinely dangerous. It creates instability. It can push your pressure too low. And it creates a cycle of anxiety and response that makes accurate monitoring nearly impossible. If you are getting value from this conversation, type the number 9 in the comments. I want to see how many of you are still with me, because what's coming next is the part I don't want anyone to miss. The protocol I recommend is this: measure in the morning before medication after sitting quietly for 5 minutes. Measure again in the evening, record both. Bring the log to your appointment. Do not adjust anything in response to a single reading. If you see consistently high readings 3 or more days in a row outside your target range, call your doctor. That is the right response, not a unilateral dose change, a call. Your blood pressure medication, whatever class it falls in, is not a rescue medication. It is not designed to be taken when you notice a spike and skipped when your reading looks good. It is designed to maintain a steady, consistent level in your bloodstream around the clock. When you miss doses, even occasionally, you create windows of uncontrolled pressure that undo the work the medication has been doing. Worse, if you stop abruptly because you feel fine or because your readings have been great, some medications create a rebound effect. The pressure climbs higher than it was before you started. This is especially true for certain beta blockers. If you miss a dose, take it as soon as you remember, unless it is close to the time for your next dose, in which case skip the missed dose and resume your normal schedule. Never double up. But ask your specific prescriber for specific instructions because the guidance varies by medication class. Write those instructions down, keep them somewhere visible, not in the back of a drawer. I want to end with what I believe is the most important point of this entire conversation. There is a particular kind of silence that I encounter regularly, and it worries me more than almost any lab result or blood pressure reading I have ever seen. It is the silence of a senior who is experiencing something, a symptom, a change, a side effect, and has decided that mentioning it would be bothersome, that it would be wasting the doctor's time, that it is probably nothing, that managing it quietly is the responsible, considerate thing to do. I want to say this as plainly as I know how. That silence is not compliance, it is not strength, it is not being a good patient. It is a setup for the day something becomes serious that did not have to be. Side effects are not a character flaw. They are not evidence that you are fragile or difficult or making a fuss. They are information. They are your body communicating something that your treatment team needs to hear. And the options for managing side effects, for adjusting doses, for switching to a different medication class, for addressing the underlying mechanism differently, those options almost always exist. But they only appear when the patient speaks up. Here is what I want you to walk away watching for: any new cognitive change, slower word retrieval, difficulty concentrating, memory gaps that feel different from ordinary forgetfulness. Connect it to your blood pressure history and mention it. Persistent headache, especially at the back of the head, especially recurring, connect it to blood pressure and mention it. Dizziness when you stand, mention it. Brief visual changes, even fleeting ones, mention it. Any sudden, severe, or unprecedented neurological symptom, go immediately, do not wait. Unusual muscle weakness or heart rhythm changes, especially if you use salt substitutes with a medication that preserves potassium, mention it. And if you have never received a sick day plan for your medications, ask for one by name. You took time today to watch something that would have been very easy to skip. That tells me something about who you are. It tells me you are the kind of person who takes their health seriously, not just when something goes wrong, but quietly, consistently in the ordinary days. That is exactly the posture that changes outcomes. Share this with someone you love who is managing their blood pressure. This is information that saves real people from real harm, quietly every single day. Right now, millions of seniors are waking up every morning with a number in their blood work that their doctor has never once flagged as dangerous, and yet it is silently reshaping the way their brain functions with every passing year. Click the video on your screen right now because it covers what that number is, why the target range your doctor uses may not be the right target for your specific situation, and what the latest evidence says about protecting what you still have time to protect.